thank you everyone for joining. My name's Benn Lancman. I'm an anaesthetist based in Melbourne and a member of the Gender Equity Sub-Committee. And we're here to participate in a webinar about contemporary issues for male doctors. So thank you all for joining. This is all recorded. I'd like to start by performing an acknowledgement of country and to acknowledge the traditional custodians of the land and country throughout Australia on which this webinar is hosted and viewed today, and recognise their unique cultural and spiritual relationship to the land, waters and seas, and the rich contribution to society. And we'd like to pay our respects to the ancestors and elders past, present and emerging. And as a binational college, we also would like to acknowledge and respect Ngā Wira Māori as the Tanaga Wenata Oratoa and its commitment to upholding the principles of Tiratia Oatangi, fostering the college's relationship with Māori and supporting Māori fellows and trainees striving to improve the health of Māori. So the way things will work today, so please, we've got three wonderful speakers today that I'll introduce you to in a moment. If you have any questions, please put them into the chat. The format will be, we'll have each of the three speakers go through, and then we'll have opportunities for some question and answer at the end. Starting with Dinesh Palipana, and he's talking about why the why is important. Dinesh is a Sri Lankan-born, now Australian. He moved here when he was 10 and has had a laundry list of amazing achievements. Is currently working in Queensland as a medical officer, primarily in the emergency department, and has been, I'll leave him to talk about more of his other achievements, but has done a fantastic job promoting disabled medical workforce and improving the lives of spinal cord injury. So Dinesh, please take it away.
Okay, thank you so much for giving me the opportunity to spend some time with you this evening. So I work in the emergency department at the Gold Coast University Hospital. And a couple of weekends ago, I was at work, and I looked after a gentleman in his 90s, and this gentleman has made an attempt on his life, and it was quite a significant attempt, and he was in the hospital, and we were tending to his injuries that evening. And we had a conversation about what happened that day, and we spent a bit of time talking. And he said to me, I feel like I have no use in this world, and I feel like I have no purpose in this world anymore. And I just don't feel like living. And it just got me thinking, I think for me, reflecting back on my life, one of the things that have kept me going through the hardest times is having a sense of purpose and having a why. Very recently, I was reading the book, A Man's Search for Meaning by Viktor Frankl. And if you haven't read it, it's a book by a psychiatrist who talks about his experience through the Holocaust when he was in a concentration camp. And throughout the book, he talks about why meaning and purpose is really important to us as human beings. So why is this relevant to when we talk about contemporary issues for men? I think there is something that Viktor or Dr. Frankl said in his book that has stayed with me, and I think I've thought about it before as well. It says that the person who has a why to live can bear almost anyhow. I think when we talk about things like depression, chronic health issues, or the various challenges that we face in the workforce, looking after our patients, caring for our families and doing what we do, I think there has to be a why that gives us the energy and it gives us the resilience to go on. I was also talking to a colleague today, happened to be wandering across to the hospital earlier, and a colleague stopped me, and he was reflecting that, well, perhaps even lamenting that maybe not all of our colleagues do this job for the same reasons. And he said, you know, for me, it's about the patients and being service to the communities. But he was saying that maybe for all of us, there are other reasons why we do the job. So I want to share with you a little bit about my reason for doing this work and how I came to be here. And actually, for me, it was because I had depression. Medicine was never the first career that I chose, and actually was never even on my radar for the longest time. When I finished high school, I didn't really know what I wanted to do, and I ended up studying university and studying law. So I became a lawyer first before medicine. But when I was in university, initially studying law, I was never really that passionate about it, and I didn't really know myself. And I tried to find meaning in so many other things. I was partying a lot. I was hanging out with the wrong people. I was getting into a bit of a life that spiraled out of control. And in the end, I ended up with depression. And it was a really, really dark period in my life. Um, it got so bad to the point where I had this debilitating anxiety. I was working as a law clerk on the side as I was going through law school. And I remember one day driving to university, and this anxiety was so bad that I pulled over on the side of the road. And it took me about half an hour to collect myself. But in that time, my boss called me and said, you know, don't bother coming in anymore. So things got really out of control, and I started to see a doctor. And I've been reading a book called Compassionomics lately, and it's about the effect that compassion can have in healthcare and its importance. And actually, it was given to me by a senior colleague, an intensivist actually, who hit burnout maybe a year or two ago, and was really fed up with the way we function as a system. And he spent a lot of time reflecting, and he gave me this book to read. And it's about how we, as healthcare practitioners and as a system, are losing this really critical thing called compassion. My doctor, my GP, when I was going through depression, I think he was a really compassionate person. He never treated me like a disease, but like a person. And I recovered from the depression, and my whole world changed after I recovered. And this was really meaningful to me, and I wanted to do this for others. So that's why I decided to become a doctor. I was just at the hospital before we got on this call, and you know, every time I'm there, I rarely feel like I'm working. And there is so much meaning and purpose in what we get to do in medicine that I look forward to going to work. I love being there. I love being with the patients. And in my eyes, when I'm at the hospital today, I don't work for a hospital. I don't work for a state, but I work for the patient in front of me. And rooting myself in that purpose when I'm at work has given me a lot of energy and resilience to go through the pressures that we go through, because it is a career that's full of pressure and intensity and struggle, especially as a system now, as doctors working. I think we face a lot of challenges, but reminding myself of why I am there every day gives me the energy to keep going. And after I actually did start medical school, I ended up having a spinal cord injury, and I became paralyzed at the age of 25 when I was a third year medical student. And I want to actually acknowledge a couple of anaesthetists that have gone through this journey of spinal cord injury and paralysis. And one in particular who's done a lot of work around disability inclusion in medicine. But that aside, it was an incredibly tough journey. I spent about 8 months in the hospital, and it was the hardest thing that I have ever done in my life. And there were many days through that journey where I felt like, where I didn't know what the future was going to look like, and where I felt like I was wandering through this fog, not knowing. But from the moment the accident happened, even when I was in the ambulance, the question that I asked the doctor that happened to be in the ambulance was, will I be able to continue my career? This has meant so much to me, finding purpose and finding meaning and finding something that I love, doing so much that even through something like a spinal cord injury, it gave me a fire to keep pursuing this dream and to keep going after it. And actually, there was a lot of skepticism about whether I'll be able to finish the career during that time. But again, I think of what Viktor Frankl said, in that a person who has a why to live can bear almost anyhow. So I did come back to medical school finally after having the spinal cord injury. And it was pretty tough going. I had to figure out how to do so many different things. And I spent the next couple of years with very little sleep and many long days trying to graduate from medical school, and I did. And here we are, 9 years later. And I feel like I am the happiest man on earth today. I really feel rich with opportunity as well. I mean, I was just reflecting today that it all feels like a dream right now. And while I have the opportunity to do so many interesting things, the one thing that grounds me is medicine. And I love going to work as a doctor still. I love seeing the patients. And it really is what gives me the most meaning and purpose and resilience and energy. So I guess what I want to share with you, or the one message that I want to share with you tonight, is that we live in a world that is changing constantly. We live in a world with so many different things going on. We have wars, we have conflict, we have political upheaval, we have social change. We work within a health system that gives us so many different challenges, both at a systemic level and with patients who are changing. But for me, it still continues to be about the why. Why do I do this job? Why did I start this journey? Why did I put in all that time to graduate from medical school? And why do I still lose sleep today to get to work and look after the patients? It hasn't really been about the medicine. I mean, the medicine itself is the vehicle in how we get to do these things, and I really enjoy the science and challenge of it. But actually, it's the human interaction and the human factor in what we get to do that is the most rewarding. And my biggest memories in medicine over the 9 short years that I've been a doctor now hasn't been about the cool things that I've seen, but rather it's about the people that I've met and the conversations that I've had with the patients through those late nights in the emergency department. So there are 2 things that I want to leave you with on that note, on the why. I've been taught that in medicine, it's not so much about what we do for a person, but it's about how we make them feel. at the end of the day. And for me as a patient, the best memories that I have of doctors, I don't remember the medications they gave or the procedures that they did for me, but I remember how they made me feel. People may not remember what we do for them, but they will always remember how we make them feel. And more importantly, my mom loves the saying that by helping one person, we may not change the world, but we will change the world for them. I think in medicine, we have the opportunity to change the world. I think we're afforded the credibility and respect by our community to do that. But I think the power that we actually have in our day-to-day work is to change someone's world, not so much by what we do, but how we make them feel. And I think it's an incredible privilege to be doing that for a living. And for me, that is the why. Thank you.
Thank you very much, Dinesh. All right, continuing on. Now I'd like to invite Liz Crowe up to the webinar camera. I had the pleasure of spending a Saturday with Liz up in Sydney a few weeks ago on a seminar for critical incident debriefing. And what I've been listening to Liz now for years and years, from when she did lectures in SMAC, and she did a fantastic talk up in Cairns at the most recent ASM. But she is a social worker who has extensive experience in grief and loss and management, and I could spend an hour talking about all the sort of interesting perspectives that she's shared over the years, but I'll leave it to her to talk about transitions in life and medicine and how we sort of can try to be a whole person.
Thanks, Ben. Thank you for having me. It's always very hard to follow behind Dinesh, I'd have to say. Can I have my first slide, please? Look, thank you very much to the college for asking me to speak. Obviously, I'm not male and I'm not a medical doctor. So what am I doing here? Well, I guess the thing is I'm a researcher and I'm particularly interested in pivotal points in people's careers. And at the moment, I'm very interested in what the generational differences are between the different generations and what that's going to mean for the workforce. I'm also a mother of boys, only boys, and I only have brothers and I only have uncles. So I've been surrounded by men my entire life. And I think it's a really challenging time to be a man. Often the only time we hear about men at the moment in the news, it's not good things. And I think all of that can be rather confronting. And raising boys myself, I hear them have those conversations. So when I was thinking about what I wanted to talk about today, and how I was going to kind of chunk that up, is to say that wherever you are in life, I think everyone thinks people who came before or people came after have probably had it easier. And that's a generational thinking mindset. So my mum used to always tell me how hard her life was and how easy my life was. My grandmother used to tell that to my mother. And then sometimes I accidentally find myself saying that to my boys. But I think every generation, something gets easier and something gets harder. And so when we're thinking about transitions through careers, we'll be able to see that there's some new nuances to what's going on based on where we are generationally. And there's some things that have always been there and always been the same. Thank you for setting this up so perfectly. So all of our wellbeing studies, my own PhD and research shows that the three main things that we need for wellbeing in the workforce is, number one, a sense of belonging. That people are excited to see me and have me in the workforce, not just that I'm an anaesthetist and I'm a body and I can take a theatre list for the day, but they're excited to see me and they remember things about me, and I feel privileged to work where I work. Number two is exactly what Dinesh was just talking about, the why, the meaning and purpose. And that's not always altruistic. Like, it'd be great if we believed it was. Like, hopefully you are there for the patients and you are there for the right reasons. But sometimes you might be able to make sense of being at work because it's paying for your kids' braces, or it means that you're going to have a lovely holiday, or that your family get to live in a safe house. And then the number three reason is mastery of skills. And wherever you are in terms of transitions, that actually doesn't change. So a number of these things follow us across whatever stage of the career we're in. And one of the big things from medicine, the research would show us, is that having a professional identity and formulating that for yourself wherever you are in your career is related to job satisfaction, and it's also related to professional performance. So I want you to kind of keep that somewhere in the back of your mind. All right, first slide, please. The other thing that I want you to think about is that also every generation and every transition of life, people keep talking about work-life balance. And I wanted to just say from the outset that it is my strongest belief, and the research I do would confirm this, is there's no such thing as work-life balance. And so we're all chasing a bit of a unicorn or a rainbow. What I would encourage you to think about is work-life integration, which again fits beautifully with what Dinesh was just saying, in that we shouldn't just be working so that we can have days off. We want to go to work and find a sense of why, meaning purpose, when we're there, and a sense of community. And whatever that looks like, that will look differently across each transition of your career. But chasing work-life integration is never going to happen, because we spend too much time at work, first of all, and work should be part of our well-being. It should be part of what's good about life. And if it isn't, then I would encourage you to have a rethink about what your life looks like or where you're working, because not every day at work is wonderful. That's unrealistic. But a bad day doesn't equal a bad life, or a bad day at work doesn't equal a bad career. All right, so let's just talk about early career and what we know from the research. So every transition, there's so much research about transitioning from a med student to a junior doctor to a reg to a senior medical officer. So this early career phase, it causes quite a number of crises as you're trying to find your professional identity. And in every stage of career, one of the things that we know that is absolutely pivotal is having people to look up to and mentor, but particularly in this early career. So there's a lovely paper from 2017 about what makes a difference for people in early career. And these are similar themes right across, right? Having people who love and care about you, so family and friends, mates at work, colleagues, etc. Number two, from an organisational point of view, is mentorship. You know, people that you can look up to of either gender, who nurture you, who want to help you along. And taking it further is this sense of allyship or sponsorship. Like, you know what, I think you should take over this portfolio. This is perfectly cut out for you. So not just mentoring, because sometimes mentoring can be a bit paternalistic, where it's like, well, you know what I did, I had this great career and you should be more like me, and this is what, you know, I would have done this. I guess sponsorship is more like, where do you want to go and how can I give you a foot up to get there? And the third thing is a broader system, and the research actually shows that a big part of this comes from people's association or your medical college. So once again, congratulations to ANZCA for putting this on today. What we do know from the research is that because there's been a delay for people, now that on the whole across medicine, across Australia and New Zealand, medicine is a postgraduate degree, we are seeing some new challenges for people at early career. So what we're hearing is that people are perhaps struggling more, and there's some generational challenges around that, but people are struggling a bit more because they're entering into their specialties 4 to 5 years behind when people who are a bit more mature, a bit further advanced in their career are getting there. And so what they're trying to do is enter into longer term relationships, perhaps buy a house, start having kids, other responsibilities, right as they're starting to study for their exams. And those things are clashing. They're competing demands for which people are really struggling. We're also seeing across the board, and I think medicine may be less impacted by this, but those early career doctors, maybe not so much, is that we are starting to see working poor, where people have got massive HECS debts from 2 big degrees. They're trying to buy or rent a house when the market is the most inflated it's ever been in Australian history. And they're trying to study and get ahead and work long hours when they've got all of these other competing demands. So that's quite tricky. Next slide, please. All right, now mid-career. This professional identity, like who do I want to be as an anaesthetist and where am I supposed to go? And I would call myself in mid-career. And it's funny because I thought by now I'd have things sorted out. I keep saying to people, I thought by now I'd know what I wanted to be when I grew up. And I think that it's an interesting phase, this mid-career, where people are trying to work out, private to public split, how many days a week they want to work, what sort of work they're actually doing. It's in this phase where people are consolidating their career. So they're thinking about like what's their contribution, if any, to the organisation like ANZCA. Are they going to, join boards, join committees, be part of education, be part of research, where people are trying to extend themselves. And unlike early career, where often people are trying to extend themselves because they're trying to maximise their chance of getting a job, they're trying to maximise their positioning or what hospital they get. In mid-career, people are often really rethinking their career options as a consolidation, like, okay, now that I'm here, what do I really want to do, rather than kind of pretend or have to conform to get the sort of job that I want. People now are calling people in mid-career, or particularly the Gen X's, which is from the late 1960s until mid 1980s, the sandwich generation. So unlike other people, this transition can be difficult because once upon a time, mid-career, most people were empty nesters and they were really starting to be able to please themselves. Because of the way that the generations have worked and people, the way they're working now, lots of people in mid-career have still got young children or adult children still living at home, and you're also starting to worry about your aging parents. And so that's why we're called the sandwich generation, because we're still kind of actively parenting and we're now starting to also worry about elderly parents. So that's a distraction. It's kind of something else that can weigh heavily and make it difficult for people to solely focus just on their career. In this phase of mid-career, we know that lots of people are trying to also get back into things that are a bit more fun. We've got to be thinking about our longevity in life all the way through these transitions. So what role does health, etc., play in that? And hopefully people are starting to lean back into a bit more extracurricular activities, hobbies, loves, things that they're actually interested in. Early career, when people are studying, they often neglect, which I don't think is a good thing, neglect all other parts of their life. And we know that that makes people feel like if you fail your exams, like everything is gone, which isn't true. So hopefully in mid-career, people are starting to once again see themselves as a bit more than just an anaesthetist or just as a doctor, but where they fit in society and what's their part to play and where they want to go and what they want to do. For some people in mid-career, this can also be a bit of a stagnation stage. You've had all this adrenaline and pressure, and all of a sudden you're kind of in cruise control. And sometimes people are like, this is actually a bit boring, or is this what I want to do? And so it can be a little bit of a crisis for people. And if that's happening for you and you're not getting what you need from your department, I think a life coach or someone outside of medicine who can really go through your interests and how much longer you still got to work. Because if you've hit a bit of a stagnation where you're not sure where you're going and you've got to work for another 15 years or you're only in your mid-40s, go and talk to someone about it. And never before in the history of medicine have we been able to marry medicine with other careers. All of us are in that boat. So that, it's about what else might you like to look at your life, knowing that there are loads of opportunities of what that actually might look like. And anaesthetics is a career where you can actually have, outside interests or juggle things a little bit more freely than some of the other specialties. All right, next slide. 15 minutes goes very fast. All right. So what does life after medicine look like? And I think, honestly, you shouldn't be waiting till you're starting to age to think about this. Early in your career, you should be thinking all the time, because at some point you're not going to work. What else makes you who you are? And my husband is much, much older than me. I'm only saying that so I can feel younger, but he is definitely in the end phase of his medical career. He's a PICU consultant, and he said to me the other day, like, I don't think I'm an arrogant person, but I'm not going to enjoy it when people don't think I do something meaningful with my life. And that's tricky. Like, often, as anaesthetists, as doctors, people really respect you. They admire your intellect. And at some point, we all just get older and we're not going to be those people. And no one wants to be the doctor walking around the hospital, later in life without a position, still showing up for things, and people going, who is that person? So what is it that you can start to look forward to? And I think that as you start to get older, it's really good not to just say, I'm going to retire on this date and go from having this big, full, rich career to an end point. As you start to age, think about, like, could you drop down to 3 days a week and see what that feels like to have that space in your life and to develop that while you still perhaps have financial and you're fit enough to build up hobbies, to build up interests. And it's not about neglecting your brain either. Like, you guys have these wonderful intellects. How could you continue to expand that, or how could you share your skills and talents beyond anesthetics to other people? And, there are so many projects happening now where people are desperate to tap into people who are older to help mentor younger people, or to help not-for-profit organisations, or young people who don't have money for tutorship. Like, there's a whole range of things, but it might be a phase where you can help develop something else in terms of research, whatever, where you're not committed to as longer hours or night shifts. But I think often that stopping absolutely as a demarcation is perhaps not a good idea. And so think about it, they talk about it as being pre-retirement. So what does stepping back and just trying what it's like to not be working all the time, seeing what that may actually feel like? So I like to think of life as a constant adventure. And I guess the goal for all of us is to stay doing something meaningful, to keep people in our lives who love us, and to feel that things are still important outside of our career. I hope that was helpful. Thank you.
Thanks very much, Liz. And just in the interest of time, we'll keep going. Next, we have Rod Mitchell, who's anaesthetist and critical care doctor from South Australia, who is currently was former president of our college from 2018 to 2020, if I recall correctly, and going to talk about the challenges of achieving work-life balance, or as we now know, is a work-life integration, maybe.
Thank you very much, Ben, and thanks for inviting me. Now, I'm very, very happy to be living in a time when I'll use the term work-life balance is topical, and there's such heightened awareness. I'm very happy to be talking about it. My message essentially is that whilst work-life balance is incredibly important, I think if we're not careful, our quest to achieve this, for the rainbow, ends up actually just creating more stress and a sense of disappointment and potentially a sense of failure. So we need to be very clear what it is we're talking about when we're talking about the quest for work-life balance. Just to be clear, I am not a published social scientist. I'm not a guru on work-life balance. I have not done any literature searches for my talk tonight. The time spent to meaningfully research work-life balance doesn't accord with my own work-life balance. I'm a 61-year-old bloke who had the good fortune of being, and I'll say mentored, following on from Liz's comments, when I was younger about the need just to really, be reflecting, considering, making sure that the things which I was wanting to achieve with my life, I was doing. I'm 61, so I've sort of seen a transition in society from men being, primarily the breadwinners, primarily responsible for working, women being primarily at home, to one where it's recognised that, men and society are both better if men are spending more time at home. Women and society are both better off if women are spending more time in the workforce, where there's now heightened awareness of the need to maintain physical health and mental health. And so out of all this has evolved this relatively new term, work-life balance. And from what I can see, this refers to finding fulfillment and meaning in three key dimensions, being personal, professional, and community. I'm very much aware that I'm following on from, I'm going to be repeating a lot of things that Liz and Dinesh have been talking about, and happily, I think we're all on accord. So the work-life model, which seems to be in vogue now, is, I'll say, personal, professional, community. Personal means that we are finding the time to sustain and nurture those important relationships. So with long-term partner, with our children, with friends, and it's really important that we have, strong friendship with immediate family. Then there's also, as well as relationship, there's a need to be maintaining physical health. And I'm told that, I should be doing 30 minutes exercise each day, at least twice a week, but ideally 30 minutes a day. And I should also be taking care of my mental health. And that means finding time for the serious relaxation and enjoyment. The Dalai Lama, who is fantastic, tells me that I should be meditating for 30 minutes every day. And if I'm too busy to find 30 minutes, then I need to be meditating for an hour every day. I'm also, this model suggests that I need to be, in accord with what Liz said, have hobbies, so commonly music or sport, but some form of relaxation. In the professional domain, I need to be working hard and finding enjoyment in my clinical work, but it's more than just clinical work now. I need to be contributing to my department or my private practice group, contributing to teaching or committee work or research. And then there's the community, and Dinesh and Liz, I think, have both talked about the fact that, we want to be careful we're not living in a box. We're part of the community, both locally and globally. And locally, in the ideal work-life balance, I would be, and I have done, a sport coach for the school. People might be involved in a local place of worship. They might be involved in a local sporting club, but some sort of local community involvement, and then some sense of contributing to the global community as well. So this package is very admirable, and I don't take Brooke with any one of those things which I've mentioned, but I have to say I just do have some concerns about this whole model, and some thoughts about how we address that. So I see three particular problems. The first problem is that this model I presented to me, and this has been pointed out to me by other people too, and particularly younger people, to me represents a very idealized representation of a very traditional work-life mix. And increasingly people are looking beyond what's traditional, and also not everybody has the opportunity to partake all of those activities which I've talked about for various reasons. So a work-life balance is not a formula. There's not a tick box exercise. It's a very personal thing that we need to think, well, what's important to me? I think the personal, professional, community framework is a good starting point, a very good starting point. But there's not, this model which I've just put forward is, like I say, very stylized, very traditional work-life balance model. So it's not for everybody. My second concern is that the model I've described to me just looks exhausting. To really, as I said, I agree with all of those components, but the effort required to actually be doing all those things, to me, just looks exhausting. And we do know people who do, they've done their hour at the gym and they're on their second latte by the time my alarm clock's going off. And I admire those people, and some people do manage to pull it off. But it just looks to me exhausting, and hence, counterproductive in terms of health and well-being. I hear the term supermum being used, and the supermum is the woman who has pulled it all off. But a successful work-life balance is not the preserve of super people. It needs to be attainable by everybody. And my third concern, and this is probably arguably my major concern, is that we need to differentiate between aspiration and expectation. And I think it's healthy to aspire to such a holistic, multifaceted life, taking care of each of those domains. However, if it's an expectation, we're setting ourselves up to either be exhausted or we're going to fail. We're not going to achieve it, and that then leads to a sense of disappointment and failure, and particularly so for women. So I'm of the generation that I've got 2 sons, 2 daughters, that raised our daughters to that they could have it all. That their gender was not going to be an obstacle to them having a fulfilling career. Unfortunately, society is a couple of steps behind, and society still expects women to carry the mental load of family life and relationships, or not relationships, but family life. And of course, women are still having maternity leave and breastfeeding at hourly interval overnight, and they're tired, and so we have given young women the expectation that they can have it all, but like I say, society is still 2 steps behind, and I think it's just really tough for women at the moment. We need to be very clear that this is an aspiration, not an expectation. So, what to do? I've got a list here of 8 things. So, number 1, work-life balance is a balance. It doesn't mean we can do everything. It doesn't mean we can do everything all at once. It's just a balance. And to achieve that balance in the limited time available, we absolutely have to just prioritize what is important to us, bearing in mind that our priorities will change through life, and my priorities now are very different to what they were, when I was 25. We need to be honest with ourselves when we are prioritizing. I've had a number of people say to me that, look, to be honest, I really love my kids, but I really do love my work too. And I don't, I clearly love my kids, but I feel torn because I feel as though I'm meant to be making my children the most important thing in my life. And they are super important, but my life does not evolve around them. And I've sort of said to those people, look, as a parent and as a partner and as a member of the department, we have responsibilities, and we need to make sure we are fulfilling our responsibilities. But you need to be honest with what is important to you, because this is an individual thing. We need to revisit those priorities at regular intervals, and because life changes, life throws us curveballs which we don't expect, and we need to deal with those and accept that our priorities are going to be changing. A number of women have said to me that in hindsight they realise that their career could wait. Now that's a bit tricky, but careers can wait, and men have said that to me too. That you don't have to do everything at once. So sometimes you just do things in phases. In terms of priorities, I would just say that no man has ever said to me that he wished he spent more time at work, but plenty of men have said to me they just wish they had spent more time with their children. And I often wonder, when I go to, well, the old saying is no man goes to his grave wishing he spent more time at work. And I do wonder when I go to my grave, what will I wish I'd spent more time on? And I find that a useful sort of, benchmark. My second point is that, and Dinesh has touched upon this, that we need to find enjoyment in our work. As we are privileged that We do, on the whole, work with really good people. We have interesting work where we're helping patients, we're making the world a better place for them, as Dinesh said. I think being an anaesthetist is a privilege, and in this work-life balance, the more we can enjoy our work, the more likely we're going to have a happy balance. And similarly, we need to remember to enjoy living. And I know for some of us, life has particular challenges, but simple things like, well, today I particularly enjoy having just a nice hot shower. I particularly enjoy listening to some music as I was driving. I've had a really nice cup of coffee. I went out with the grandkids and just had the sunshine. It was just beautiful on my skin. There are so many simple things in life which we can enjoy. You don't need to wait until you're on the golf course or catching a wave. If we can just remember to enjoy the simple things in life, the privilege of work, then the work-life balance is likely to be a much happier equation, regardless of the relative proportions. The grass is greener where you water it. So if your work-life balance, and those domains I talked about, if anyone particular is not going as well as you like, don't change. Just add more water. Rockefeller was asked in the 1930s, how much money does a man, how much is enough money? And he said, Rockefeller was a squillionaire. He said, just a little bit more. We do work in an environment as anaesthetists where our peers have lots of money, have great lifestyles, have the beach house, they go traveling. And it is just really easy to get to adjust our expectations accordingly. Money is nice. Okay, don't get me wrong, money is nice. But in terms of how much do we need, I think there is a trap where we just need a little bit more. So just we need to be careful of that. Someone said to me once that it wasn't the quantity of time he spent with his kids, it was the quality. And he reckoned that if he just, each child, he had 5 kids, each child, he would give them 10 minutes of uninterrupted, one-on-one intense time. That was enough. And I personally found that the 5-minute back scratch at the end of the day when the child's just going off to bed has just been a sort of a good time. So it's quality, not quantity. And if we're juggling with time pressure, I think that was good advice for me. The final thing I would say is, I'm just looking at the time here. Be kind to yourself. In the spirit of being your own best friend, just be kind to yourself. We make decisions along the way. Sometimes we regret those decisions, but we make decisions in good faith with information available. We do the best we can. Like I said, just be your own best friend, because you're the only one that's going to be there forever, and the one who understands what's going on. So just don't beat yourself up if you make some work-life balance decisions which you regret. We just do the best we can.